more, but because of time, I want us to break it down a little bit. So generally, according to statistics that were given in this survey that was done in 2017, I want us to move fast forward to 23, and according to you, what is the general status of the health and sanitation within Kampala metropolitan region?
Thank you. The sanitation situation has not changed as per that statistics to a significant level. Okay. We are still struggling to get the communities move from unlined pit latrines to lined pit latrines, especially in informal settlements. As you could imagine, about 70% of Kampala is largely what we call informal settlements, the slums. And this is where we are getting the biggest challenge of sanitation facilities. So the statistics is largely the same. And we get this, realize much of these challenges of the effects of poor sanitation facilities during wet season, because the sanitation behaviors of our residents are worse when it is rain season. So that's where we really need to put efforts and to have the people of Kampala appreciate the need to move to proper sanitation facilities. But
as we speak right now, Doctor, what is the stand? How many Ugandans, how many people in the region are now connected to the national sewer line?
If you talk of national sewer line, largely covers Kampala business district, basically central division, and just a part of the other divisions. So we are talking about less than 30% of coverage. And we hope that this should be prioritized to bring more people on board, especially as we see expanding into the rest of the other divisions away from the center within Kampala. We know it will take a lot of time to get majority of our residents on the national sewer line. Of course, for a number of reasons, the costs involved to have the infrastructure of the national sewer system, but also the cost of meeting the requirements for sewer line at a household level. So what is practically possible is to encourage construction of lined pit latrines to replace the unlined one, which are a big danger to our people within informal settlements.
Okay. Also, about 3 years ago, as you reviewed your budget for KCCA, it was discovered that as a city, we collected about 2,022. I hope I'm saying that right. 222,000. Thank you. Yes. 222,000 cubic meters of fecal sludge from septic tanks and pit latrines. But according to that same survey, the budget as you read it, KCCA's contribution was about 13%, and the rest of it was going to the private sector. Now, I was listening to Dr. Elias Lukwago trying to break it down on why it was contributing just 13% from KCCA, and he said now most of the emptiers in KCCA were grounded because they were faulted. And because of that, most of the work was being done by private. Is this also still a challenge? And if it is still there, is it one of the leading problems that we are facing, this extremely unhygienic condition within the city?
So you probably are aware that we have public toilets in Kampala, but also at individual households, there are many septic tanks that people do have. So our public sewer trucks cannot cover both public and the private individual septic tanks. So you realize that as KCCA, we cannot move away from working hand in hand with the private sector in addressing this challenge. But of course, what was highlighted remains a recurrent problem, because these trucks keep on breaking down, and there are fewer in number, which is a very critical challenge. But we also know that to have the the adequate number of trucks to cover the entire city is practically not realistic. That's why the contribution of the private sector is critical. So we do take into consideration what our public trucks are able to do and also what the private trucks are supporting to be able to document what we have been able to collect over a specified period of time. And as we encourage more people to improve their sanitation facilities at household level, we expect the demand for these services will keep growing. Of course, as also we strategize on how to make it more effective in reaching everybody and timely. So that is really where our effort
focus is.
Yes.
Okay, what about, let's talk about solid waste management.
Right.
How about how many tons of solid waste do we manage to collect per day within the region?
Because I don't have that statistics of head. We have a team that is charged with the solid waste management team, but we do collect a lot of it. One of the indicators we track under solid waste are the backlogs of solid waste, which tell us how much we are doing under that component. So if we are able to eliminate all the backlog of solid waste within the city, then we shall have made progress. And of course, there are so many other interventions aimed at reducing solid waste coming into Kampala, especially at market level, where the vendors are encouraged to bring what actually is required, not to bring plus the waste that accompanies. For example, if you take the example of Sematoke, you know what the communities need in the market is the real matoke.
Yeah.
No, not the matoke. How do you call it?
The banana leaves.
The banana leaves sometimes, which they wrap the bunches of matoke in.
Yeah.
That is a necessary waste to bring into the city. So, if there is a bit of waste reduction at in the communities where these items are coming from, then we shall be receiving little or less waste to ferry out of the city.
It looks like there are still so many stumbling blocks to us achieving sanitation within the city. What are the real major challenges that are coming from the residents now, that is from us, that are causing an issue and making us lag behind when it comes to sanitation and hygiene?
Yeah, so the issue is just information. We have tried to reach out to the residents. So we would wish that they are able to appreciate the negative consequences of poor both sanitation, hygiene, and waste within the city. For example, we don't know if sometimes where the public do appreciate the effects of heavy flooding due to clogged drainage channels, and this get blocked due to waste which is dumped aimlessly all over. And when there is a heavy downpour, of course, the storm water collects all this, and
everything is just
packed and blocked the way, and the consequence is flooding. And this is a recurrent problem in Kampala. The community need to appreciate that wherever they face a consequence of flooding, it is an outcome of our personal individual practices, which we need to seriously address. We know that during rain season, it is a time when many infectious diseases spike. Of course, because the dampness and the lot of the poor sanitation around the different areas are quite favorable for the rapid multiplication of disease-causing germs. And at the end of the day, it is the resident of Kampala or the person doing business as Kampala whose life is at risk and who falls sick. But if you trace the pattern of events, you realize that at individual level we've made a contribution to that. So the communities need to listen to advice from all the health experts out there. But we also, of course, as KCCA, we are trying to do all the efforts to make sure that we reach the communities through various channels.
Speaking of KCCA, I believe you have standards that you have put that we need to meet. I would love to hear some of those standards that you have put up for us to maintain hygiene and sanitation. Now, we will say that maybe we are not meeting the standards, but I want to hear the standards that you have put.
Yes. Starting with, say, sanitation facility, like I indicated earlier.
Okay.
If one is to put up a toilet facility, we have clear standards for what it should be. And for example, the online toilets are not allowed in the city for the obvious reasons. And the the water table is easily contaminated. But more importantly, on our part, is that it is very difficult to drain it using our cesspools because the walls will collapse. And yet, if you look at the households in Kampala, people build on a very small piece of land, maybe 50 by 100, or sometimes less than that.
Actually, most of the time it's less.
Unlike in the villages, where when one online pit latrine fills up, you close it and build another one next. That possibility doesn't happen. So you can only go on emptying the one you have. So the online one does not support evacuation. So that is a basic standard which is there for everybody in Kampala, and would want all residents of Kampala who are unable to do the septic tank, possibly to move to the lined pit latrine, because that one it is easier to empty. So that's one of the standards. The other is, for example, the water we use. The protected springs in Kampala are all contaminated. We do not expect our communities to be using them for household use. But you realize that this is still happening in a number of places. Now, you can see the risks involved. So, what would be the advice that for communities who cannot get the national access to national water?
So that means that the number of people that are having access to clean water right now is also really low within the region.
Yeah, the access is the reach is there, but the use, because some communities you find that they are close to national water, but for one reason or the other, they prefer the other water, which is to them considered to be free of charge, while this one comes at a cost. So that is a challenge, but our guidance is that if that is the option out there, then how do we make this water safer? It can be treated. We have water treatment chemicals out there which can be used to treat the water to make it safer, the chlorine and other treatment chemicals. But the other is, of course, boiling before use. We know that would also be costly for the ordinary person of Kampala, because mechanism of boiling this water all is not cheap for residents of Kampala. So, but we know, for example, during this outbreak, we were able to put up some stand-up pipes to facilitate access to safe water. Of course, we are encouraging the local communities where the pipes are to be able to use them communally, so that everybody is able to access safe water.
Okay. So as a city, as we wind out, I wanted to ask your perspective of this. As a city, we have a vision and a mission of attaining a vibrant and sustainable city by 2030.
Right.
So as we speak right now, according to you, do you think this is going to be achievable by 2030?
Of course, we think we shall be able to achieve that. We may not make 100%, but, but
I was going to ask you that with the statistics that we are dealing with, I don't know if it's still going to be achievable.
It is we are on a journey, and you must have a target, either in terms of time, for distance that you have to cover. It keeps you motivated. Yes. So we know. Even the stakeholders, partners that come on board want to be on the same page with us on what our goal, our targets are. And these targets which were set by KCCA are quite realistic. They can be achieved. We know at the time of setting this target, did not predict that there will be disruption of the economy by COVID-19. Which of course slowed the progress which was being made. We can agree on but that should not be, we still have a lot of time. That should not be really the excuse. We still have a lot of time. We have 6 years to go, which is a lot of time. So just getting everybody on board, making those small steps at the household, individual level. For example, if we talk about disposal of plastics, you sometimes have been disappointed to see a person in the car through the window.
Throwing garbage out here.
Yes, and you see that this is a behavior which if every person at individual level says, I commit not to do this, will make a lot of changes. So
and I can admit you have managed to put a number of dustbins around the city.
Yes.
You have done a great job on that.
Yes. They are quite in place. But for those in moving car, because it may be difficult for them to get out to look for a dustbin, we encourage them to keep their dustbin within their car. And they dispose at their point of destination.
So, Doctor, we have run out of time, but there's one more question that I would love you to answer in the most simple way possible. Right. You talked about having targets as KCCA, you have goals to meet. So I want to know, do these targets and goals you have, are they being funded by the national coffers, or maybe we are relying more on the donors?
Yeah, both. We have programs that are directly funded by government of Uganda through the national budget funding. But we also have many programs that are donor supported. So it is a joint effort. And also at KCCA, we, as employees of KCCA, we also write proposals and compete with the other players to attract funding to the city to ensure these programs are running. So we are grateful, of course, to the donor community for that, but also we keep on making a case for the government of Uganda to improve funds allocation to KCCA. For the obvious
I like how you have handled that. You've packaged it really well. You're relying on both the donors and the national coffers, but you would love them to do a bit more when it comes to fulfilling. But we've come to the end of the program, Doctor, and it is a pleasure that you have been here. It's a pity that it has not been enough time for that, but you can get another time.
Yeah, sure.
You can discuss that off camera. But thank you so much. That is at the end of the show today. I'm Genesis Namale. Make sure you turn up tomorrow again sometime here at Bethany TV, and we dig deeper into some of the existing challenges and also maybe the top stories of what is going on in the country.